I want to talk to you a minute about what to expect with the COVID vaccine in the weeks to months to follow. You're going to see things in the news media. Some of them may be sensational, some may freak you out, some anti vaxxers might use to try to dissuade people from getting the vaccine. I got 5 points I want to make today to kind of help get you through this. I'm Dr. Larry Burchett, MD, actively practicing in this COVID pandemic. This video is powered by averpoint.com. Please go there and check out the evidence that we're using to discuss these things. Let's get into the top 5 things that I want you to know heading forward with COVID, given what the news media is going to do. Number one is there will be side effects to the vaccine. Well, what are side effects? By side effects, I mean undesired consequences, but they're not a big deal. Most people, 2/3, and this is according to Pfizer's study of their vaccine, feel soreness in the shoulder and the arm where the injection site was, right? That's pretty common. About half of people, 50%, felt 2 symptoms, very common: headache and fatigue with the vaccine, okay? If you get the vaccine when it's finally your turn, those are not out of the ordinary. You can take Tylenol. Tylenol is probably the recommended medication for that. When I got the vaccine a couple weeks ago, I had headache and fatigue. Took Tylenol, it went away and never came back. I had it for a couple hours. Wasn't a big deal. The study also noted about 16% of people had fever. Again, these are common side effects that come with vaccines. So if you see articles or people saying, oh my gosh, people are fatigued and headache and fever, it's just like, that's part of getting a vaccine. What is one thought as to why people react like this and have these kind of reactions? When you get a vaccine, it's stimulating your immune system. So it's simulating some kind of foreign invader, object, whatever, that your immune system then reacts to and builds antibodies. So these are actually signs, headache, fatigue, that your body is working and doing what it should do with this vaccination. They're actually good indications of good things going on, even though they're often uncomfortable, headache, fatigue, and whatever. They're temporary and they go away, including fever, okay? So that's an accepted one. Number 2, there will be serious life-threatening allergies to this. Very, very rare, okay? So they didn't document they didn't have any in the 19,000 people that got the vaccine in the trial for Pfizer. Serious adverse allergies is about 1 in a million with most vaccines. I don't know what this one will be, 1 in 500,000, 1 in whatever. As we roll this vaccine out and millions of people get it, you're gonna see serious vaccine allergic reactions in the news. It's treatable. I've had patients with this. I've treated them. Most people do fine. This is one of the reasons that we monitor people for 15 minutes when they get the COVID vaccine. But I want you to anticipate that this is a known, potential, very rare, and can be serious, but treatable adverse event from this. 1.3 in 1 million. That's the kind of average number that we're talking about. And you're going to see, so this is the whole point of one thing that I want you to anticipate. In the study, 18,800 people got the vaccine, and their data said they didn't have any serious adverse reactions in that amount of people, okay? Nobody in 19,000 got a serious reaction. But the super rare stuff, the 1 in a million stuff, we're not going to see that until we give this to 1 million people. The risk is very small. We are going to start seeing this. I want you to anticipate it. It doesn't mean we should not give the vaccine, because COVID is still killing 3,000 Americans per day. We should absolutely give the vaccine. And it doesn't mean that the vaccine is 100% safe. I think it's 99.99 whatever percent safe, right? These are 1 in a million things, but there are adverse reactions. And I want to review with you some other serious adverse reactions that have happened that are common in other vaccinations, because there's going to be weird stuff that results from this this vaccination, okay? And that doesn't mean we shut it down and stop. It means that there's a small risk that's far outweighed by the benefits. So here's some in history. Here's some other ones. Got to get my old man glasses on. There were no serious reactions in the 14 weeks of this trial, okay, for the Pfizer ones. But here's some examples. So MMR, measles, mumps, and rubella, 1 in 20,000 get what's called ITP, idiopathic thrombocytopenic purpura. It means platelets go down to a serious level, 1 in 20,000. This is known. Maybe the COVID vaccine will affect platelets. Maybe it won't. I don't know. 1 in 20,000 have had that with another vaccine. Again, very, very rare. Febrile seizure. This is when young children, and this isn't really going to happen in this one because febrile seizure is typically in younger children, 6 months a year, a couple years old. They don't have, doesn't happen when they're 10. 8.5 in 10,000. This was observed in both MMR and varicella. Remember we talked about fever. Some people can get a fever with the COVID vaccine. This is 15%. Less than 1% had a really high fever. Sometimes when you get a super high fever, you can have a seizure. Again, more common in children, treatable, not permanent damage. Fever control is important. If you have a fever, take Tylenol. It's not really recommended to take it beforehand. But again, I can imagine news media being like, somebody got the vaccine. Oh my God, they got a fever and had a seizure. 8.5 in 10,000, that's a fairly, it's still uncommon, but not 1 in a million kind of thing. You might see some of that. That's okay. I've seen countless febrile seizures in young children in the ER. We evaluate them, make sure they don't have any serious infection. We treat the fever. We lower their temperature with Tylenol, ibuprofen. Sometimes we put ice packs on to get that fever down and stabilize them, and then teach the parents about how to do fever control to prevent this in the future. And they're fine, and the kids are fine. It doesn't result in permanent neurologic damage. Seizures can be very scary, but it isn't something to freak out. These are things that may happen that shouldn't stop us as this vaccine is being rolled out. Another complication, this one was interesting. So rotavirus, there's a rotavirus vaccine given to children. Rotavirus is a very infectious cause of gastroenteritis, vomiting, and diarrhea. It can often spread a lot through daycares and schools. And so a vaccination was created to prevent all of that problem in schools. And one of the complications from that vaccine, unique to that one, is this condition called intussusception. It's where your intestines, here's my demonstration of that. See how it it's called telescoping on itself. It's like the intestines go like this, and I know it's terrible, but you get it. Go like that and they get stuck. Can be a surgical emergency, can be, a lot of times it resolves on its own or with minimal treatment. 1 in 20,000 to 1 in 100,000. This is a known risk of this vaccine, okay? I give these examples from these different vaccines just to show you that in vaccines, there's a small risk of some severe complications. And I am willing to bet that there will be something severe that comes from the COVID vaccine that we will see as millions of people get this in time. It should be part of the consent process. Hey, there may be rare, serious complications. Most likely, you won't get them. Some people will. Don't freak out. It's part of the game. The risk for individual people has to be less than the benefit in order to move forward with vaccine. I think for most people it is because COVID is so deadly, right? That's the message and what I want you to be aware of and anticipate as we move forward with this stuff. Now, there's another thing that I wanted to throw in here. This is number 4, which is you've probably heard that the virus mutates and its genes, its genetic code evolves a little bit. There's this recent variant that appears to be more infectious and contagious than the old one. So there's uncertainty about, well, what does that mean for the vaccine? Does it mean things are going to get a lot worse? What does it mean? Also, we don't exactly know. Okay, people get vaccinated, and it appears to be 94% effective within 2 months at preventing COVID in a certain population of people. But what about at 3 months and 6 months and 1 year? How many antibodies do you still have from the shot then? How long does it last? We don't know. So you may see changes to the vaccination schedule. You may see at 6 months or 9 months or a year, a booster is recommended, kind of like a flu shot. It depends. Like, does COVID, do 200 million Americans get the vaccine and COVID is gone? Do we struggle with not getting enough people vaccinated and it lingers? Does COVID mutate a little bit and we have to change the vaccine in 6 months or 9 months or a year? All of that is uncertain. We don't know how this is going to play out. I would anticipate that there may be adjustments to either the vaccine or the vaccine schedule as this thing plays out and we learn more, including it may be recommended to get an annual COVID vaccine. Don't be surprised if you see that kind of stuff. Don't freak out at every headline. It's important that we look at reality and we see what's going on and we adjust and we make our next best move based on that. This thing's going to continue to evolve. Number 5, the thing that I still want to hammer home, that I still believe in and have the faith in with regard to the vaccine and what to anticipate, is that COVID is going to end. The vaccine is going to end COVID. It's not a 100% certainty. I can't tell you for sure that tomorrow an asteroid isn't going to hit Earth, explode, and we're all going to die, right? But from where we've come so far, that we have this vaccine, we've got multiple vaccines, we've invested in it, the pandemic's going to end. The vaccine is going to end the pandemic. We're not going to tolerate people dying at these numbers forever. Really, we shouldn't be tolerating it, what's going on right now, but that's a whole nother video. I'm sticking to my guns. The vaccine will end the pandemic. You may see discussion, articles, anti-vaxxers, worries, fears, all of this stuff that's going to question that and make it seem more uncertain. This thing will end and the vaccine will have the biggest part to do in ending it, far more than herd immunity, which after, 8, 9, 10 months, we're at 5 or 10% of the population's been infected. And I want to say that maybe we've rolled out, I think there's 10 or 20 million doses of the vaccination, and maybe 4 million people have gotten vaccinated, a little over 1%. In time, the vaccine is going to provide immunity far more than actual infection. The vaccine is going to end the pandemic, and I'm standing by it. Thanks for watching these 5. Check out the evidence at averpoint.com. You can always reach out to me at Dr. Larry Burchett on all of the socials. You know the sign-off. Stay safe, stay sane, do your part. We are going to get through this thing. The vaccine is going to end the pandemic.